Hello, my name is Jose Name. I'm going to talk about how to perform osteophyte drilling when we perform endoscopic surgery of the lumbar spine. I start by showing this short video in which it shows the way I did the drilling previously, which occasionally led me to disorientation during the surgeries because sometimes the anatomy was lost. I performed a drilling of the bone from the surface to the depth, and many times I lost one of the most important anatomical landmarks when one does a stenosis surgery, that is the tip of the facet joint. So I start giving the first recommendation. Never perform the drilling from superficial to the deep or from caudal to the cranial aspect because it can lead you to an anatomical disorientation. I also recommend locating the osteophytes in the lumbar spine CT scan so that you have an idea of how this structure will look during the endoscopic surgery. This is a couple examples of the osteophytes in CT scan. So I always recommend drilling from the cranial part to the caudal aspect. I will show you how easy this procedure is. The first thing is to identify the cranial lamina and the descending facet, inferior articular process, and the upper edge of the osteophyte, as you can see in this picture. In this image, we recognize the spinal process, the lamina, the flavum ligament, the IAP, and the osteophyte. The next step is to identify the upper edge of the osteophytes, as you can see on the right side, and then we start drilling. We use a drill, but, but when drilling, you have to try to preserve the cortical surface of the lamina. We are going to drill in the direction of the inferior articular process all the way down until we see the tip of the joint. So we remove the osteophyte with the help of the endoscope cannula, performing also lateral traction so that we remove the osteophyte easier. As you can see here, do not forget that we must preserve the cortical bone. In this case, we use the cannula of the endoscope, and when we reach the tip of the joint, we see how the osteophyte detach automatically, so we preserve the anatomy and remove the osteophyte very quickly. So we are already seeing the joint and the tip of the joint, so we can clean the joint using graspers. That's the tip of the joint after removal of the osteophyte. So we go further, we clean the joint, we can do the surgery. The second case I show you here is in almost all the cases, the process is repeated in the same way. In the same manner, we identify the cranial edge of the osteophytes and we proceed with the drill and with lateral traction of the cannula of the endoscope from the cranial to the caudal direction to remove the osteophyte until it detaches and shows us easily the tip of the joint, as you can see here in this short video. After the osteophyte is detached, you can see easily the tip of the inferior articular process after the removal of the osteophyte. After this, so we identify the tip of the joint and we can already use the drills that we routinely use to start stenosis surgery, and we can begin drilling the tip of the joint and continue the surgery. Then the message to take home is the following. To remove osteophyte is easy and safe when we remove the osteophyte from cranial to the caudal direction. This process does not take more than 1 minute, and the biggest advantage is that by performing in this way, you have less possibilities to get a disorientation during the surgery. Thank you so much.